Hello everyone, my name is Dr. Vallabh Chawla and today we'll be doing a case study on lateral canal as seen in CBCT. Okay, so basically this patient was referred for a CBCT scan for the upper left posterior region or the molar region you can say. So this is the first molar of upper left side. You can just have a look at it, the mesiobuccal root canal. As you can see, periapical pathosis is seen in the mesiobuccal root canal. This is the distobuccal root canal as seen. Again, periapical pathosis or PDL widening is noted, whereas in mesiobuccal periapical pathosis or abscess is seen. And coming to the palatal root, this is the palatal root. So palatal root also pathology is present as seen on the uh, palatal aspect. So basically doctor wanted to know if there are any extra canals, so patient was referred for a CBCT scan. So in this case, we arrange the lines along the long axis of the tooth root. So the lines have been arranged now. You can just increase or decrease the brightness of the contrast. You can just do the changes. And now we'll be just setting the mesiobuccal root. This is the periapical pathology which is seen. So, and this is the axial cross section. You can just go from the crown region down towards the root region. This is the mesiobuccal root canal, this is the distobuccal, and this is the palatal. So as we go down, this is the mesiobuccal MB1, and as we go down, no, there is no evidence of MB2 canal. MB2 canal is not seen. Otherwise, it may appear as a faint radiolucent dot, just like how it is seen in distobuccal. A similar dot may be seen in case if there's any presence of MB2, but here MB2 canal is not present. Okay, so but still periapical pathology is seen. So just to see if there's any kind of extra canal or not, you can study the same thing in smallest thickness. You can choose the thickness to 0.5 mm instead of 1 mm, or even small as 0.2 mm, just to check if there's any kind of extra lateral canal or not. As we go down towards the periapical region, or you can see the lower middle 1/3 region, you can see a small radiolucent line. This is the radiolucent line which is seen in the axial cross section. We'll just mark this line over here. This is the radiolucent line which is seen well. If you want, you can increase the sharpness, but increasing the sharpness will also bring a lot of image noise, and hence it's better to keep the sharpness close. We can just see the same thing in thickness 1 mm, but as we go to thickness 1 mm or say thickness 2 mm, so the radiolucent line is not very well appreciated than what we see in 0.5 mm or the 0.2 mm. Same line, when you just arrange it along the long axis of the tooth, the same lateral canal can be appreciated in other cross sections also. It may not be very well evident in all the cross sections, but you can just have a look at it in other cross sections. You can see the similar lateral canal that is seen in the coronal aspect as a radiolucent thin line noted, and it may just appear as a single dot in the sagittal cross section. Okay, so the lateral canal is also responsible for periapical pathosis, like especially on the lateral aspects of the root, and hence it is very much necessary to fill the lateral canal as well. So this is just a diagrammatic representation how they appear. This is just a 3D diagrammatic representation. It may appear anywhere in the middle 1/3 region, in the lower middle 1/3 region, in the periapical region, can be present anywhere. Okay, and hence when the biomechanical preparation is done and the sealer is used, we have to make sure that all canals are filled along with the lateral canals or the accessory canals. Okay, so the same thing, you can have a look at it in different cross sections. You can increase or decrease the thickness as well, and you can just reduce the thickness to 0.5 mm and have a look at it. And the similar thing you can study in smallest cross sections, just the periapical region of this tooth in smallest cross section 0.5 mm thickness. Also, you can just decrease the thickness to 0.2 mm. You can just customize it to 0.2 mm and study the scan. So we'll just get this to the mesial root, and it may be seen in some cross sections, it may not be seen in cross sections. So it's always better to do a study on the XYZ view also. So this cross section definitely tells us that MB2 canal is not evident, MB1 is evident. Rest you can see it in other cross sections. You can just make a coronal CMPR view and study the axial cross sections. If you want, you can just decrease the thickness to interval lines to 0.5 mm to study the canals Okay, so this is the tooth of concern. MB2 canal is definitely not seen. You can just search for the lateral canal wherever it is present. Just get it down apically. Okay, so once you get it down apically, you can see this is the MB canal, MB1 canal. Okay, so here again a small dot is evident, which is seen. You can just magnify this thing and just see the dots that are available. Even other cross sections as well. You can just decrease the thickness to 0.5 mm, as it is not very well evident in 0.1 mm, sorry, in 1 mm, so you can just decrease or increase the thickness accordingly. Okay, so but mainly it's always better to have a look at it in the axial, coronal and sagittal cross sections. Okay, so basically this was just a scan to study the lateral canal. Okay, so you will just have to fill the lateral canals to avoid any kind of periapical pathology. Okay, thank you so much.